After that very invigorating session where a lot of focus was on areas where India needs to really now prioritize in terms of its growth agenda, I think it's also important to now focus on, when you talk about India's governance model, how is it that you actually get there? The last mile connectivity, that connection from outlay to outcome, how does that happen? And that happens through India's massive bureaucratic setup, the bureaucracy that actually ensures that from the vision, from the roadmap, to actual delivery, how that actually happens. In fact, this panel actually has some very, very renowned bureaucrats, those who've actually done work across the delivery of welfare schemes, some very important administrative decisions, to really help us understand that when you talk about the future, when you talk about what is it that India now needs to focus on going forward, what should be the role of bureaucracy? What should a future bureaucrat in 2050 really have as a skill that can empower her to ensure that the roadmap, the vision that we talk about right now gets fulfilled? Thank you so much, all of you, for joining in this very wonderful session. Let me start first by asking that all of you have actually done work specifically, whether it's in the field of health, whether it's rural development, very important administrative changes that India saw when it comes to Jammu Kashmir. Your thoughts on how it happened, the X factor, and most importantly, the lessons and learnings that Indian bureaucracy needs to keep in mind. Dr. Mehta, let me start with you, sir.
Am I audible? Is it working?
Yes, sir.
Okay, thank you very much. Very interesting question. So the question was that what happens at the last mile, how programs get implemented. As far as I am concerned, let me begin by saying that during the last 12 years or so, a lot of prophetic changes have come about, and that needs to be recognized. One is the digital public infrastructure. It has changed India. For example, the very fact that we have things like Aadhaar, so you can identify every person. You have DBT, direct benefit transfer. You have UPI. And UPI is great, but not many advanced countries also have that kind of facility where every person is enabled to do transaction digitally. So digital public infrastructure has changed India to a very large extent. And that is one of the things that has been carried out well. And in case of Jammu and Kashmir, let me say this, that J&K was not known for digital infrastructure, right? And 2021 we started, and by 2023 we were #1 in the country. So this can be done, and this is NESDA assessment, not our own assessment. So J&K within 2 years had become #1 in the country. And in January of 2023, we had said that all interaction with the public will happen through digital means. That was first thing that has happened, which has changed India. The second point, financial inclusion. Now if you look at what has happened in the last 12 years, Jan Dhan Yojana, PMJSBY, PMJJBY, all those programs have come in, and people at the grassroots level got included in the financial architecture of India. And this has helped. The third point was that in terms of basic infrastructure, a lot of changes came about. Saubhagya got implemented. Every village had electricity. Then Jal Jeevan Mission. Then we had PM Gram Sadak Yojana, so on and so forth. So infrastructure, the basic work has been completed, and it's gone down to the last level. The point you were asking, that there are so many things, I'm not going to count all of them. But one transformation, apart from digital, that I was associated with, how J&K was managed post 370 abrogation. And that is a story in itself. I am very happy to tell you that you would have not heard a single instance of stone throwing post abrogation of Article 370, right? When not a single day of bandh, no hartals, nothing. How does this happen? This happens because there is a clarity at the political level, at the top level, and the bureaucracy. When the aims are clear, things happen. And mark my word, when the motive is clear and when the direction is clear, then bureaucracy is pretty capable of delivering on that. I'll give you one more instance, Namami Gange. How many of us would have thought that Ganga would actually get cleaner than earlier? But today, Ganga polluted stretches have come down from 355 something. It has now come down to 296. So Ganga is cleaner than earlier, right? It may not be perfect, but it's definitely cleaner. So when it comes to delivery, I think when the direction is very clear, it does happen.
The distinction of the sets of decisions that you pointed out is important, because when you talk about Jammu Kashmir, abrogation of Article 370, what followed, the massive political, constitutional, administrative changes, is a very large part of how bureaucracy handled a delicate time. And then, of course, is the delivery of schemes, particular flagship programs like Namami Gange. An example of when there is clarity in terms of how deliverables need to be achieved, it actually gets done. Very important point. Mr. Sinha, I want to bring you in on, I think, the biggest piece in the puzzle, which is around our rural development, something that you understand so well, sir. India, if you want to understand India, you've just got to understand the sheer scale at which we operate. And I think nothing tells that better than rural development. Your thoughts, sir?
Thank you, Gauri. I had the privilege to be at the leadership position for the pro-poor public welfare programs between 2014 and 2021. I'll limit my comments to that period and to say the scale was astounding. And the scale was achieved not only because of technology, because technology is only a means. It's not an end in itself. And that recognition is important. If I were to share numbers, women under the Rural Livelihood Mission in self-help groups, 2014 we had 25 million women who were part of this, mostly from the southern Indian states, Bihar and a couple of other states. 2026 we have over 100 million women who are a part of this movement, the Lakhpati Didis that you hear about. I had the privilege to lead the entire process for a long time as Secretary Rural Development and later as advisor to the Prime Minister. Clearly, it did make a dent. The second thing is the housing program. The scale is unimaginable. When we were designing the Pradhan Mantri Awas Yojana Gramin, it was the best of minds of professors of schools of planning and architecture, IIT, other places, looking at local resources, designing building structures, and thereafter choosing to implement. So you raised the issue of the last mile. I have covered most of this in the Routledge book that I published in 2023, which is called The Last Mile, Turning Public Policy Upside Down. To the scale of 30 million homes over a period is again astounding. The third, the Pradhan Mantri Gram Sadak Yojana began at the turn of the century, but it was going on and on and on. But the mandate to us was very, very clear. We must connect all habitations as per the plan and definition well in time. So clearly the pace that comes as a consequence of it. The fourth and the last one, 2018, suddenly one day we were summoned to a meeting that 7 benefits have to reach the poorest villages of the country under the Gram Swaraj Abhiyan. To identify the poorest villages, we said we'll go by the deprivation data or the data with regard to the scheduled caste, scheduled tribe households in different parts of the country. Total of 63,974 villages were selected, and I was given a time of about 6 months and 2 phases of a Gram Swaraj Abhiyan to be able to ensure that these deprived habitations, every eligible person gets a gas connection, gets LED bulbs, gets the electricity connection under Saubhagya, gets an accident insurance, gets a life insurance, gets immunization coverage, and a bank account for every woman under Jandhan. Now 7 tasks to be achieved within 2 mission mode campaigns over a period of 6 months to cover every eligible in the most remote parts of the country. That's why along with technology, the connect at the last mile, the panchayats, the leaders of the 31 lakh panchayat representatives of whom 43% were women, the 100 million, 10 crore women in the self-help groups, right. The foot soldiers as also the frontline workers, all governments, all states coming together, central government officials, state government officials together trying to ensure that it actually happened by the end of it.
I think that's a very important point that you've raised. And And now that I want to get in Preeti ji also, which is the other side of how the backbone of Indian delivery system functions, which is in a crisis, which is in an unprecedented situation. We spoke about administrative changes, we spoke about welfare schemes. Let's also now speak about adversities that nobody, no government, no politician can ever plan for, which was the pandemic. And you were at the helm of it, ma'am, to really, decide how best we can chart out our trajectory around that time, ensure that India comes out as little infected as it was. Tell us about the role that Indian bureaucracy played during those toughest times, which was around the COVID pandemic.
So, thank you for asking this question. First and foremost, I want to put it on record that it was whole of government approach. It was not only whole of government approach, it was whole of society approach. And incidentally, it's very, very heartening, I would say, that India stands as one whenever a disaster strikes us. We've seen it time and again, whether it is Operation Sindoor, whether it is any flood, cyclone, and of course pandemic, because we just didn't know what has struck us, where it has come from. We had no, I would say, confirmed news on what's going to happen. So what did we do? Actually, I would say that we had a proactive, graded, and collaborative, approach. No state or even center could have done it alone. We were all together. And I retired in July 2020. I was to retire in April, but I retired in July 2020. I attended some 10, meetings of Honorable PM with the Honorable Chief Ministers. And it was most gratifying that all of us were on one page. If you recall, it's not to make a comment, but just to highlight how we were all one together, is that, if you remember in US, the response in California was different, the response in New York was different. So it was all states were doing what they wanted to do, but we were together.
States were asking each other masks and were not being given. It was that bad. Yes.
Yeah, but here, states, whoever needed masks were given as per the cases. And of course, I think as highlighted by Mr. Mehta, my colleague, that digital actually innovations made lot of difference. And we had this e-learning platform of eSanjeevani, where medical colleges used to actually talk to each other periodically. And within 15 days, CDAC Mohali converted into a telemedicine software, eSanjeevani.
Yeah.
So you see, all of us were talking. AIIMS Delhi had a toll-free number 24 hours a day.
Yes.
And there was a lot of skepticism that, well, Indians, they are not educated. Will they wear masks? Will they? Because we have this habit of hugging. We have habit of, holding hands and all that. No. How beautifully all of us followed all the directions.
Yes.
So that is India.
And I think the distinction that you pointed out is extremely significant. When you made that distinction about America, it's so important because that time states in America, in fact, Donald Trump himself was asking for masks and PPE kits from California and other states, and they had flatly refused the president that time. It is unbelievable, but yes, that's how it was. It's important that we highlighted specific areas and experiences to really understand the different layers at which the Indian bureaucracy functions, the layers at which decision making actually gets done. Let me now talk about, we've had DBT and digitization have a huge role to play both in terms of targeting of schemes and also bringing in a lot of trust. Trust and transparency is a function of the digitization that has happened. But let's now look ahead. Let's now talk about what next can be done. When you talk about the next 10 years, the next 15 years, the rapid pace at which technology is coming in, that's really set to transform delivery for goods and services, and also expectations. What the government should now be doing for the people of this country, the young people of this country, and how much can tech be an enabler? Your thoughts there, sir. Dr. Mehta.
Okay, thanks a lot for asking this question. And I think it's very, very important. If I look at what India is to do and hasn't done yet, then the first thing I would like to point out in so far as technology is concerned, we have a technology deficit, innovation deficit, which we need to admit and address that. If I look at AI, we probably are not even the first 10. If you look at the space power, we are definitely not top tier. If you just look at the numbers of satellites, USA has more than 10,000 easily. China has more than 1,000. We have less than 100, maybe around 50. It's just so asymmetrical in terms of technology that we need to understand that without technology, we are not going to compete. A nation of 1.4 billion, it cannot be second to anybody. It's an existential issue. It's a security issue. I can't overemphasize it. Whether it look at oceans, if you look at ocean technology, we are nowhere near there, nowhere near USA or China. If you look at space, same problem. India needs to lead now, and India needs to take into account that a country that could do so well in many areas, we should bank upon ourselves to ensure that we create disruptive technologies. If possible, at fuel costs. If not, then we need to invest. Okay. Being a technology laggard is not an option for India, and I'm very clear about that. Otherwise, what will happen, and I would like to take this opportunity to say this, you can face an AI colonialism, you can face a data colonialism. It's time to get worried about that. And what you have seen in Iran versus USA and Israel war, their systems were taken over by Starlink, and they could broadcast whatever they liked, right? Now that can happen to somebody else as well, some other country as well. So in terms of technology, I think it's time to take into account that we can't be a laggard. We have to be in the top. It's not good enough to say that we are in the middle tier or just below the top tier. We need to get into the top tier. And for that, whatever investment is required, and it is being addressed, I agree. But I think we need to more focus on that. Was that your question?
Broadly, but let's get it, Mr. Sinha, also on how do you scale up the engine? The engine is working. We've got experiences, real life experiences of all of you telling how that engine is working. How do we scale that up is the point, and future-proof it.
No, the scaling of a minimum level of living based on all the interventions did lead to changes in the chronic poverty picture for the country. But obviously that is not enough. Now when you wish to move beyond this, and that's where from a Lakpati Didi, we'll have to move towards a 5 Lakpati Didi. You know, the earnings, incomes have to rise much more. For that, human development is the key challenge. When we look at China and India, leaving aside every other difference, the biggest difference is on the scale on education especially and skills and what it means for the entire systems of economic governance as also for investments. So clearly human development, urban challenges, the quality of lives in urban areas for the working class, it needs top attention. It needs attention because otherwise it can compromise the pace at which we urbanize, thereby compromising the rates at which GDPs grow, because surely urban areas report much higher rates of growth. But putting all this together is the important need to accept collaborative governance as the way forward, where we take non-state actors very much as part of the consensual decision-making process. If I look at some of the indicators, we've set up schools, but quality of learning is not happening. We've set up health facilities, but there are challenges on quality services. These wicked problems need collaborative governance, a governance where citizens have a consensual decision-making role, not just a membership of a committee. So clearly for the India of the future, given the mobilization that we've done, can we now move towards devolution and decentralization on scale? Because if you look at the states which devolve have higher monthly per capita consumption expenditures. The same Kerala, Sikkim, Goa, Himachal, Tamil Nadu figure at the top. The same states report a lower level of multidimensional poverty, and the same states also report on incomes a better profile. Clearly, the linkages of devolution, decentralization, incomes is a direct one, human development, education levels, 10 years of schooling, and you do a profile of all the districts. You get the real picture of where we need to do what and on what scale. So we need the scale for human development, for rising incomes, for more skills, and most importantly, quality of lives in the urban governance systems as well, so that we are able to meet the needs better. Thank you.
Okay. Preeti ji, I want to bring you in on the one fact I think which is most important, which is around what kind of a bureaucrat India needs now, as against what kind of bureaucrats that served us in the last 10, 15, 30, 40 years. Has that requirement changed? Should that change? And if so, is the UPSC that you were a former chair of keeping pace with that requirement? I think that's most important.
So I would like to say that it's very heartening when I read the topic of this session. It is machinery of change, not the steel frame. Yeah. Okay? So that is the main point. So bureaucracy is machinery of change. Yes, we are the steel frame, but that's not enough. We have to be the machinery of change. So first and foremost requirement is that we must, as a bureaucrat, we need to be adaptable. Adaptable means to, as you said, asked me in the beginning that, unforeseen situations may arise. So what to do? Do you have the resilience? And then if, you have to make sure that you are looking into diversity and equity while implementing schemes. Do you have the honesty and the integrity to do so? You are going to dealing with, digital media, social media. Do you have the ability to, not make it personal, but institutional? So, you see, these are the new qualities in bureaucrats that is required.
Is that being tested adequately in the mechanism that exists right now?
Yes. Now, I would like to say with some amount of satisfaction that the training modules, even in, wherever we are trained, is actually getting...
Selection. What about selection, ma'am?
So, I recently attended... presided over one workshop in Administrative Staff College, where this is exactly what was asked. Bhai, jab aap interview kar rahe ho, what is it that you're looking for? Are these people have prepared from institutions? Are they just sitting, like robots and answering? What is it that you need to ask so that you get to know the ethical level, the morality, the resilience, the innovative approach, and most important, empathy of the person you are selecting. So these are now being looked into, and as you know that we have a paper on ethics also in UPSC now. So lots of churning is going on, and I'm sure this is a process which is continuous. It's not as if we are done with it.
I think there are a lot of people who've actually voiced their opinions about what kind of an examination system, selection system should India actually now have, given the way we are now envisaging the future of India. A 2050 bureaucrat, how should he or she be selected given the present mechanisms, the kind of courses that are important, the kind of languages in which the examination can be held. Those are lots of questions, and I think they need to be addressed at some point of time in an appropriate manner. Given the paucity of time, the final question I want to ask all three of you is that if one reform was to be done, undertaken for specifically with regard to bureaucracy, with regard to the machinery that's actually hopefully going to bring the kind of change that we all aspire for, what is that one reform that India must undertake?
Okay. let me say that we can't have a 20th century bureaucracy in 21st century. Now, the routine functions that were carried out by bureaucracy for a long time, which was basically examination of application, seeing that the application is right and then approving it, those things can be done by AI and robotics. We don't need bureaucrats for that purpose.
Will there not be resistance from these same bureaucratic levers if AI starts getting implemented?
Just a minute. So, we need to reinvent bureaucracy, and from routine examination to problem solving, handling crisis. Suppose someday some digital infrastructure fails, then that is the point of time they will be called upon to perform those functions. So completely reimagining bureaucracy, because in the modern world, information is a power. And those people who, basically I would say that, who is sovereign in India is people, right? Who is being served? People are being served. Whose dignity are we talking about? People's dignity we are talking about. It's all about dignity. Not today, I don't think that we are treating people with that dignity which they deserve. So dignified bureaucracy, dignified service delivery is that what we look at. And that is possible today because the technology enables you to do so. So I think that I would like to see a 21st century bureaucracy which is tech-enabled, problem-solving, not file-centered, but citizen-centered, and treating citizens with dignity. And that is fundamental. And it can be done.
It can be done. Okay, that's the most important word. Yes, sir.
No, I think the slowest movement is always on civil service reforms. If there is one change and transformation, both of mindsets and ways of working, it is to wholeheartedly and organically accept the concept of collaborative governance, where citizens are equal partners in the service provisions. It's important also to realize, as a part of the civil service reforms, one, the institutions that you create in a collaborative governance framework, along with the challenges of gender empowerment and inclusive development. The NFHS 6 data has just come out, and when you do the analysis, you see that picture very clearly. States which tackle the gender empowerment more effectively has better indicators. If these are the messages, civil service reforms ought to be about development, because we transitioned from being a regulatory civil service in colonial times. We perhaps took up development responsibilities, but didn't reform enough in our ways of working. And
okay, that's an important point.
Yeah.
Very quickly, Preeti ji,
I'd like to say quickly, not repeat what they've said, but when we talk about collaboration, it is actually also means that making people, ordinary people, part of decision making. I want to just relate an example. Amarjeet spoke about gender also. When I was collector Mehboob Nagar, we did an exercise. We gave a canvas to men and women groups separately. So what do you want? It was a district where there was no water available and people used to go out, Palamur labor, earth workers. The men made roads, right? So that they can reach the areas where they could find employment. Women made tanks. They wanted water in their villages so that people stay there. You see, they have employment in their village, the children go to school. So when a woman is involved in decision making, she thinks about the entire family. So what I'm saying is there are many models in which you can actually make ordinary people part of decision making. What do they want? We need to ask. That's true collaboration.
I think India is a sum of whole when it comes to all of these stories, and the challenge is to really bring all of it together. And how that happens in the India of, let's say, 2050, 2047 is, I think, going to be the real challenge. I'm going to leave it there. Thank you so much, all of you, for joining us in this session.